Hello, everyone. Today we will talk a little bit about pigmentation, but it will be a little bit different from the most common, lectures about pigmentation because I want to give you some insight of the secret of a pigmented cell, those things that we don't talk about very often, and things that are very unique that maybe will give you a hint of, why you cannot control your pigmentation. So without further ado, let's start. This is a summary of all the processes that are involved in pigmentation. And actually, I start creating this imaging, this drawing, almost 10 years ago when I started researching pigmentation. And the one that I have right now is so complex that when I try to put it in this presentation, it looks like a really hot mess. So, but this is what it's telling you is like the process of producing pigment is extremely complex, and hence the process of controlling overproduction of pigments is even worse because we need to consider all these factors that are, and this is a fraction of the factors that are involved in the pigment production. Things that are important to remember, you have factors that come, from the environment, internal, and from the dermis and immune cells. So there are several factors that we need to consider to have a good control when your melanocytes start producing excess of pigment. Okay, so what is melanogenesis? It's basically a multi-step, we saw that, several steps involved in this process. It's a physiological process that results in the synthesis of a complex, darkly pigmented biopolymer called melanin. And melanin is synthesized in melanosomes, and melanosomes are lysosomes-related organelles in melanocytes. So melanocytes are very unique cells which main function is to produce this pigment. And hence they have these very specialized organelles that produce the pigment. So what produces the activation of melanin? And as I mentioned before, there are several factors. The most commonly known are the external factors. For example, you have UV light. It was described in the 80s that UV light produced photoaging, and photoaging produced these coarse wrinkles and all these changes in the skin. And one of the changes in the skin was this stubborn hyperpigmentation that was uneven hyperpigmentation that results in spots and what is called melasma. We also know that ozone can do that, and also right now pollution. So one of the things that we observe when we start studying, cohorts of women in Asia, Asian women are not, worshippers of the sun. So they always do everything to cover themselves to have pristine, like beautiful skin. And most of them, they start developing pigmentation and even hyperpigmentation, although they were never exposed to the sun. And the studies were done, and we found out that is pollution, the one that is triggering this hyperpigmentation. So we have external factors that produce this pigment. But we also have internal factors that produce uneven pigmentation. And oxidative stress is one of them, hormonal changes, allergies via activation of mast cells, and mitochondrial dysfunction, which is strongly linked to aging. So as we're getting old and our skin is out of balance, it's not healthy anymore, we have a bigger chance of producing uneven pigmentation. And I always say that the most important factor that produces hyperpigmentation is inflammation. And inflammation happens in response to everything, basically. Everything that damages our skin or take our skin out of balance, it will produce a certain level of inflammation. So there is this new concept called inflammaging. So basically, as we are getting older, we are getting inflamed. And that basically will get into the production of uneven pigmentation in your skin. But also if you have, like a mosquito bite, or you have a cut in your skin, a surgery, if you burst a pimple, if you squeeze a pimple, those type of inflammation also can produce, uneven hyperpigmentation, and basically it can be very stubborn, depending on the type of skin. So the activation of melanin synthesis is like, as I say, there are several signals that come from, different sides of the skin, different parts of the skin to activate the synthesis of melanin. Why? Because melanin has a very unique function. Melanin is there to protect the DNA of the cells. So whenever you have damage in your skin, you will produce melanin, and it will be basically acquired by keratinocyte, and this will surround the nucleus of the keratinocyte to protect that DNA, because DNA is gold. You want to keep your DNA in pristine condition to avoid, in the worst case scenario, the production of cancer, and in, like in less severe scenarios, to have damage on the function of keratinocytes and basically not having a fully functional and healthier epidermis. So basically, one of the things that we saw, and one of the things that is not very well taught these days, is like there are some signals that come from the dermis that reinforce the production of melanin. So we always think, like uvuli hit your keratinocyte, they produce all these signals, all this inflammation, and you have basically production of melanin. But damage, like extracellular matrix or damaged fibroblasts because of aging or because of environmental aging, they also send the signal to melanocytes to produce this pigment. Remember, melanocytes are sitting on the top of the base membrane, and they are basically on the edge between epidermis and dermis. So they are in a very good position to communicate with both sides. Okay, so melanin synthesis. I will not go over this. We know that it's a key enzyme called tyrosinase. Tyrosinase, there are actually 3 types of enzymes. We have tyrosinase and tyrosinase-related protein 1 and 2. All of them, they produce melanin. Long story short, a lot of oxidation, a lot of reduction, electron going from one place to another. And we have the production of 2 types of pigments. One is brownish, the other one is red. The type of pigment that you produce, it will depend on your genetic background. Okay, so how the melanosynthesis happens? So melanosynthesis is a beautiful process. It happens in 4 stages inside of the melanocytes. So first you have, the activation of this process by either UV light, inflammation, or whatever factor. And you have the formation of these melanosomes. And the melanosomes basically are, basically kind of like sacs that contain the tyrosinase, and inside of them, melanin is produced. So in the first stage, they are colorless because they are basically, it's a sac that is getting assembled to have all the components to function. The stage 2 has striations, so it has this kind of line that you can see here. And these are basically, to deposit tyrosinase. So all the enzyme will be anchored to this kind of striation, and they will be producing pigment. In stage number 3, you start seeing deposit of melanin on this striation because it's where the enzymes are. And stage 4 is the fully mature and fully melanocyte melanosome. And these melanosomes are the ones that will migrate to the edges of the melanocyte. Remember, melanocyte looks like a hand, basically. You have the body of the cell and dendrites or extension of the cytosol that try to reach keratinocytes. And these mature melanocytes will migrate to this and basically go and be transferred to keratinocytes. And that is where they will provide the DNA protection. So how this happened, this is a very complex process. We are still not 100% sure of how the process happened, but we know that it's happening because we can see the pigment in our skin. It has been shown that there is an epidermal unit that has kind of like one melanocyte is in close association between 30 and 40 keratinocytes through these dendrites. So this is very awesome because when you look at the amount of melanocyte that you have in your skin, you don't have that many. But you see that this cytosolic extension can touch 30 to 40 keratinocytes and basically can transfer melanin to 30 to 40 keratinocytes. The process of melanin transfer is not very well understood. We think that it's mainly due to phagocytosis or mainly due to micropinocytosis. So remember, melanin is insoluble, and the melanosomes are basically kind of very compact structures. So it needs to be kind of engulfed by the keratinocytes to be brought inside. So, but we are still trying to figure it out, which is the actual process, or could be a combination of them. Okay, so the other thing that is important, and this will be important for some of the information that I will give you later, is this epidermal, melanin units, the one that is formed by one melanocyte in around, 35 keratinocyte, also has a large number of mast cells around that. And this is very important because, you know, we all know, all the allergy sufferers, we know that when we are in the middle of the allergy season, we tend to hyperpigmented more. When you have allergies, you know, eyes allergy basically, or the skin around the eyes, that tends to darken more. So there is a role that these mast cells played in the pigment production, and it's basically they are in the right position because they are in very close contact with the epidermal melanin unit. Okay, so let's talk about dermal melasma. We know epidermal melasma. What happens is basically you have the transfer of pigment to your epidermis, and it's kind of like the natural way how the pigment is you know, like a transfer. Usually, you know, like the pigment has only one way out, so that means that the epidermis needs to be renewed. That is the reason why everything that increases the cell turnover helps you to get rid of the pigment very fast. One thing that you have to remember when you are using, you know, products to even your skin tone is like there is, as I say, the only way to get rid of the pigment is to remove it from your skin. So it will be a moment where your skin will look worse than before. And usually it's because the pigment that was way inside in your epidermis now is coming to the surface, and it will be more visual. So I always like to remind people that around week 3 or 4, you may see something that looks way worse. Keep, you know, the faith and basically continue using the product, because that is just that you are removing pigment that you didn't see before. So basically that is epidermal melasma. It's like a staining of your keratinocyte. What is dermal melasma? So for a reason that we don't know, in dermal melasma, we found the melanin in the dermis. And healthy skin does not have melanin in the dermis, like healthy, well-balanced skin. And this gives to the skin a very unique gray bluish color. Now, when you like when you have a very bad melasma, sometimes you have a combination of both dermal and epidermal. And if you do something really aggressive treatment like hydroquinone or like with you know, like something really aggressive to remove your epidermal melasma, your skin will look like gray or bluish. I call it the Smurf you know, syndrome. And it's because you remove so much pigment from your upper layers that the dermal pigment now is giving you this kind of like blue-gray color. So something to keep in mind if this happened to you. Okay, so let's continue talking about dermal melasma, but linked to the base membrane. So what is the base membrane? The base membrane is a structure that is between the epidermis and dermis, and is formed by several different types of protein. And collagen 4 is one of the most common proteins there. And not only provide a physical separation between the dermis and epidermis, but also allows the structure of the skin to be maintained. For many years, people thought that it was just, you know, a structure that separates both. But what we know right now is actually facilitate the communication between dermis and epidermis. Like there are several molecules that are able to get signals from the cells, from the surface, and pass it to the dermis, and in the other way around too. So, okay, so one of the things that we have seen, you know, in dermal melasma lesions, we can see that 90% of the dermal melasma lesions, they show a damage in the base membrane. So something to be aware. Now, 80% of these dermal melasma lesions have antibodies against collagen 4, which is the main component of the base membrane. And we also know that UV lights destroy the base membrane induction of MMP2 and MMP9, which are they are collagenizers that destroy collagen 4. And UV light is linked to dermal melasma. So there is an indication that there is damage in this structure that, you know, like keep the integrity of the skin and the fluid communication that may be linked to the appearance of pigment in the dermis. So one of the things that is very interesting is that in dermal melasma, especially when you have, you know, base membrane damage, you find something that is called pendulous melanocytes. So normally, remember that I say the melanocytes are facing, the dendrites are facing up, so facing kind of like to the top of the epidermis, because they need to transfer the pigment to keratinocytes. In this case, in the case of dermal melasma, for some reason that we don't know, these melanocytes flip and basically protrude their dendrites into the dermis and start transferring the pigment there. So we don't know why this unnatural movement happens, but we do know that the disruption of the base membrane is a requirement for this flip in the melanocytes, like orientation. So what happens once that you have, like this change in the orientation? Well, we have now, like the melanocyte facing down and basically dropping melanin into the dermis. Melanin is insoluble, and dermis doesn't like to have things that are not soluble. So macrophages will come in because they will produce a kind of inflammatory process. They will try to eat the melanin. And as melanin is insoluble, macrophages will form something that is called melanophages. So melanophages are macrophages full of melanin inside. And these melanophages act like cells that in the tattoo. Basically, they eat the melanin, try to break it, they cannot, they die, and other, macrophages come, eat what is left, and the cycle state, melanin cannot be dissolved, the pigment stay there, but you have kind of like an engulfing of these by these macrophages that are trying unsuccessfully to destroy melanin. So your dermal melasma is very similar to what happened with a tattoo, and hence the way to treat it is very similar to how we get rid of unwanted tattoos. Okay, another important component of melasma, and this is for all melasma, is the neovascularization. So when it comes to melasma, pigment production is linked to inflammation at the end of the day. And we know that the areas that are linked to melasma, the areas that are basically highly pigmented, either epidermal or dermal melasma, they have a formation of new vessels. So there are areas that when you look at using this camera, there is a VISIA camera that allows you to see different type of colors in your skin. You can see that the dark color, basically, the brown color, which is melanin, is overlapping almost perfectly with red color. And the reason is because that area is highly vascularized. So new vessels were formed to provide immune cells, to provide, oxygen, to provide everything that it needs to that area. It has been shown that, keratinocyte in melasma lesions, they produce factors that promote this new growing of vessels, such as VEGF. And they also have an increased level of nitric oxide. So nitric oxide is a free radical. It's a fantastic molecule. I love nitric oxide, which when it's produced in very, very small amounts, allows you to control, the blood flow in your vessel. So it's something that is produced normally. When you have an inflammation, you have the production of nitric oxide by a different enzyme, which is called inducible nitric oxide synthase. And this nitric oxide produces largest amount, so much bigger than what is produced normally. And this is a free radical that loves to interact with superoxide anion and produce a peroxide that is super harmful. So every time that I see a product that claims to promote the production of nitric oxide in the skin to boost the rossiness of your cheek, it gives me the heebie-jeebies because I know what nitric oxide does in your skin. As I say, it's a free radical. You don't want to produce extra ones. So it's much better to do this to get, rosy cheeks rather than to add something that has nitric oxide. So, but everything, what is happening here is like we have an inflammatory process and hence we have neovascularization. And when we basically are treating melasma, we need to take that in mind that there were new vessel formation and there is an inflammatory process. Okay, so as I said before, the epidermal melasma unit is formed by, your keratinocytes and your melanocyte, but also remember I mentioned that they have a lot of mast cells around. And mast cells are fantastic because they can be your friend or they can be your foe very fast. They are like immune cells that have the capacity to produce growth factors, cytokines, and also they have, inside histamine and bioactive amines that play a huge role in the allergic responses, but not all the time they produce both of them. So we know that, when it comes to melasma, we have the mast cells in the right spot. And what we have seen is like that these mast cells, basically in this unit, in the epidermal melasma unit, becomes activated. And when they're activated, they promote pigmentation. They help to disrupt the barrier, the basement membrane, because they produce a lot of, pro-inflammatory cytokines and other proteases that can basically physically damage that barrier. They also increase the new blood vessels, like the new blood vessel formation, by releasing growth factors that basically will promote the formation, the neovascularization of this area. And they also produce, tryptase that is basically can activate MMPs. So the MMPs that were not damaging your extracellular matrix now can be active and damage your collagen elastin and basically promote aging. So activation of mast cells is nothing that we want to do if we are trying to prevent pigment or preventing aging. Now, we know that in the melasma lesions, there are a larger number of mast cells. So normally they're there, but when you have melasma, you have an even bigger number of them. And it has been shown that, for example, if you have a photoaging in your skin, so damaged by UV light, you have a larger number of mast cells in your skin. So this kind of and they are basically located in a very unique area. So that is something to take in consideration. Histamine release, that basically, that is one of the hallmark of activation of mast cells. It's able to produce melanin, to induce the production of melanin, because melanocytes have receptors for histamine. Not only that, histamine can boost the production of melanin through other growth factors that are involved with this. So kind of act synergistically to them. So we have these mast cells basically promoting the production of pigment. And the other thing that I just mentioned is mast cells are very abundant in areas of solar elastosis, which are linked to photo damage. And these areas are very linked to melasma. So again, next time when you have an issue with your pigmentation and you cannot basically control this, think about controlling neovascularization. Think about if you're using any product that promote, like a blood flow to your skin. Think about mast cells activation. What are I'm doing that basically it could be activating my mast cells and producing this damage. Okay, so with that in mind, we will go and review three, I think there are three very unique, unusual pigment correctors. These are in early product development. We don't know if they will work, but at least give us some hopes that new technologies are coming to the market that can help those starborn pigmented areas to be removed. So the first of them is metformin. Metformin is very popular right now because a lot of people that are not diabetic are using this to as an anti-aging drug. So it's an anti-diabetic drug that decreases glucose production in the liver and it absorption in the gut by the guts, and also improves the uptake and utilization of glucose. So basically, makes you way better. And one of the things that it does is basically, and the reason why people are using it as an anti-aging molecule is because when you are taking this orally, you can basically decrease the formation of glycosylate products, decrease inflammation, and we know inflammation is linked to aging. So that is the reason why this is that is the rationale of using this compound for anti-aging. So from a cellular level, metformin decreases the levels of cyclic AMP, which is an internal messenger in the cells, and cyclic AMP are key regulators of pigment production. So basically, when you have in your melanocyte increasing production of pigment, your levels of cyclic AMP goes up. In this case, as metformin decreases this, can control basically in theory pigment production, and also alters the pH of melanosomes. And this is very important because the pH of melanosomes is important to produce the pigment production. You need to have basically at the right pH to produce melanin. So very interesting mechanism. And if you are taking metformin already for anti-aging, it could be that it's helping with your pigment production. So there are a couple of studies that were done using metformin. One of them showed a decrease in melanin production, but metformin using, reconstitute human skin and human explants. So this means petri dishes. In petri dishes, you add metformin to the top, treat them, either with a cream or in solution, and we saw that the melanocytes in those, like models produce less amount of melanin. So far, so good. There is another study, there is a clinical study that showed around 40 patients, these were melasma patients, that they compared the efficacy to 30% metformin to a triple combination cream, which is the one that contained, like hydroquinone, retinoic acid, and a corticoid. And that is kind of like your super gold standard for the treatment of pigmentation, for very, very stubborn pigmentation. I do not like this because it has corticoids, and corticoids decrease the thickness of the skin, plus a lot of other stuff. So I do not like this unless it's the last resource that you can use for the treatment of stubborn pigmentation. Okay, so what they saw, they show similar results, at week 8, with metformin showing better tolerability. You can understand that when you have, like hydroquinone, retinoic acid, and corticoids in one cream, the tolerability is awful. People experience very large amount of adverse events. And, like metformin was very tolerated and similar results. I have to say that when you have a study that is done with 40 subjects, the chances of not having a statistically significant differences is very high because you don't have the power of a statistic. So, but, it could be something that we can do in the future, increase the number of subjects in a study to make sure that the results that we are seeing is because the similarity in the results, in the outcomes that we are seeing is because of these two protocols being equally efficacious and not because we don't have the power of a statistic. Okay, so that is metformin. So basically, if you are taking that and if you have seen an improvement on your skin evenness, you are not crazy. It can be something that is happening because of this, compound. The next one that we will talk is small interferon RNAs, so also called siRNAs. So what are these? They are very unique sequence of RNA that silence the expression of very unique genes. So what is beautiful about this technology is like I can decide for one gene and I can say like, I don't like MITF, which is one of the genes that are very involved in the production of pigment. I want to silence that. So the moment that the gene express, the messenger for this, I will add my siRNA, it will bind to it, and it will destroy it. So it's equivalent to to not having expression of the gene, basically having this small interferon RNA. So, and this technology makes sense because we have so many, overactive genes when we are like talking about melasma or hyperpigmented skin. At the same time, it's like, how many siRNA we will need to use to have, like the result that we want? Because remember, like, because hyperpigmentation, because melasma is multifactorial, whenever you stop one factor, the other one goes out of control. So you need to basically grab all of them at the same time and decrease their activation. So, but it's a very unique technology that maybe will have some results in the future. So there are a couple of studies that were shown some very, promising results. This was done with 56 subjects. The reason why I don't like this study because it has PIH, and PIH, depending on the skin that the type of skin that you have, it could be something that is easy to remove. In my case, I have my background is Latin, so basically, every time that I squeeze a pimple, I suffer 6 months at least with the pigment that is like facing me in the mirror. So. So the test product was a cosmetic cream that delivered, siRNA against MITF, which is one of the key transcription factors associated to melanin production. And what they observed is like a noticeable improvement at week 4 in the color of the PIH areas, and a significant improvement at week 12 of the treatment, so 90% lightening. So you almost resolve this in 3 months. And what was very interesting to me is like they show normalization of melanin content when compared to untreated skin. So kind of like you take this back to normal, which is great. The results timeline and the impressiveness of the results is not that much, because if you use a, like a good pigment corrector and, your retinoids, you will have similar results for PIH, especially if you use retinol, which is much better than retinol. But, and you will have other benefits like anti-aging benefits, and, benefits related with the smoothness of the skin and things like that. So I think this is something that can be very nice in the future, but these results don't impress me very much. The last one that we will talk is like proton pumps inhibitor. And probably when I say that, you will think about, heartburn. And that is exactly what we are talking about. We are talking about those, substances that are present in your omeprazole or, esomeprazole, this type of capsule that you use it to prevent the stomach for overproducing acid. So when they are applied topically, proton pumps inhibitor, they may inhibit melanin production by inhibiting an ATPase, a proton pump called ATP7A. And ATP7A is key for tyrosinases function because they participate in the addition of copper to the tyrosinates. So you need to have basically a very unique pH for copper to be added to tyrosinases. And this is the key for the oxidation process that happens during the formation of melanin. So if you don't have the copper added, you don't have basically, if you don't have the acidic pH, you don't have the copper added, you don't have an active tyrosinase, hence you don't have production of melanin. So that is the rationale behind that. So there is only one paper and in 2015 that I found. So I have the feeling that maybe this died because nothing else has been, produced. But what this paper shows is like, when you, and these are, skin models that have the epidermis and melanocytes. So whatever you add to activate them, they will become dark. And they also add, they activate the production. So this is your control. So just very dark, they are producing this melanocyte producing melanin. But when you activate this in the presence of different concentration of proton pumps inhibitor, melanin production decreases to a level that, the tissue is basically almost with no brown color. So pretty cool, could work. We don't know. One of the most important things to me related with this proton pumps inhibitor will be what will be their effect on the microbiome, because microbiome requires an acidic pH. Maybe this can basically block or alter the pH of the skin, and that could trigger something that we don't want. Okay, so what are my final thoughts about this, all this information that I just gave you? A multifunctional pathway is required to address hyperpigmentation. So we know there are several factors that are involved in hyperpigmentation, coming from the environment, internally, from keratinocytes, from immune cells, from dermis. So we need to address all of them to be able to control hyperpigmentation, especially stubborn hyperpigmentation. Hyperpigmentation and anti-aging must be done hand to hand. Why? Because if we have a damaged dermis, if we have a photo-aged dermis, if we have a dermis that is inflamed, we will have signals toward, the melanocyte to produce melanin. So if we don't address aging and damage in the healthiness or the level of skin health that we have, we will not be able to control hyperpigmentation. And the good thing is, like in the horizon, we have new technologies that have been evaluated that may provide, another tool to combat hyperpigmentation. We require more clinical data, but this is very important because there is a lot of effort to find new technologies that will be added to the mix. Remember, there is not a single technology that can address the entire pigmentation issue. So if there is a product that is selling you that they have the one and only, technology that can block hyperpigmentation, probably they are misleading you, and it's a combination of them. So one final thought that to me is the most important thing is like, yes, we know how we can, we know that the melanocytes go from normally producing melanin to overproducing melanin, and we know how to kind of prevent this production of melanin using different factors that, push the brake on those hyperactive pathways. My main issue is that we don't have the technology yet to tell a hyperactive melanocyte go back to be a normal one. So I am not sure if this is something that is possible to do, or once that the melanocyte go out of control, it will stay out of control forever, and we will basically need to deal with this treatment of hyperpigmentation for life to keep these overstimulated melanocytes under control and to prevent the overproduction of melanin. So thank you so much. If you have any question, please don't hesitate. These are, part of my information. So feel free to contact me, and take care.